Hello everyone. My name is Vartika Singh and I'm a second year life science student of Hansraj College, Delhi University. Today I'm going to talk about the role of nutrition and personal hygiene in public health. We are going to look at how these two work together to build a foundation for a healthy, productive society. When we talk about public health, we are looking at the bigger picture, like how we keep entire communities from getting sick. Think of it as a dual defense system. On one hand, you have nutrition, which is your body's internal armor. It builds your immune system to fight off long term diseases like heart disease and diabetes. On the other hand, you have personal hygiene, which acts as your external shield. Simple things like washing your hands create a physical barrier that stop germs in their tracks. When we get both right, we don't just live longer, we create a more stable and productive economy because people are not constantly weighed down by illnesses. Now, we are going to understand what nutrition really means. World Health Organization defines nutrition quite simply as the balance between what we eat and what our bodies actually need to function. Nutrition is not just about eating enough food, it's about eating the right kind of food. To keep the human machine running, we need the big six nutrients. We have the macronutrients like carbs, protein, and fats, which provide energy and structure. Then we have the micronutrients like vitamins, minerals, and water, which regulate our body functions. The body needs a balance of these big six nutrients to function properly. Without this balance, even a full stomach can still mean poor health. But it's not always about just getting enough food. We face what's called the triple burden of malnutrition. This is a massive challenge in public health. It includes undernutrition, which means a person is not getting enough calories, overnutrition, which leads to health issues like obesity, diabetes, and the most dangerous one, hidden hunger, where a person might look well fed, but their body is actually starving for those vital vitamins and minerals. Now, the question arises, why do we focus so much on what people eat? And why nutrition is a public health priority? Let's look at how nutrition directly impacts public health. First, disease prevention. A well nourished body has a stronger immune system, which helps fight infections and lowers the risk of diseases like obesity, diabetes, and heart diseases. Second, cognitive development. In children, proper nutrition supports brain growth and improves learning ability and school performance. This later translates into a more productive adult population. Third, mental well being. Certain nutrients, such as omega 3 fatty acids, play a key role in maintaining mental health and reducing stress and depression. And finally, economic stability. Healthy individuals miss fewer workdays, perform better, and contribute more effectively to the economy. So, nutrition is not just a health issue, it's an economic investment. Now, let's talk about our first line of defense, personal hygiene. The WHO defines hygiene as the practices and conditions that help maintain health and stop the spread of disease. It's more than just a morning routine. We can break this into seven key areas of personal hygiene, including food, body, sleep, dental, nail, and respiratory hygiene, such as covering your mouth when coughing or sneezing. From brushing your teeth twice a day to making sure your clothes are clean and your food is covered, these simple daily habits are actually sophisticated health security measures. Now let's understand the role of personal hygiene in public health. Personal hygiene plays several crucial roles. First, it breaks the chain of infection. When individuals practice good hygiene, germs fail to spread, protecting the entire community. Second, it reduces the global disease burden, especially diarrheal and respiratory diseases, which remain major causes of illnesses worldwide. Third, it combats antibiotic resistance. By preventing infections in the first place, we reduce the need for antibiotics, helping to preserve their effectiveness. Fourth, hygiene boosts economic productivity by reducing absenteeism in schools and workplaces. And finally, it promotes health equity. Hygiene practices are low cost but highly effective, protecting even the most vulnerable populations, regardless of access to advanced healthcare. Now, I want you to see how these two concepts are locked together. We often talk about the three pillars of health: sleep, exercise, and nutrition. But let's look the relationship between nutrition and hygiene. Nutrition and hygiene are deeply connected. It is a vicious cycle. If you have poor hygiene, you get frequent infections. Those infections drain your body of nutrients, leading to malnutrition, and that malnutrition then weakens your immune system, making you even more likely to get sick again. You cannot fix one without the other. They must be addressed together. Modern public health strategies recognize the need for integrated approaches. It highlights the shift from treating nutrition and hygiene as separate issues to managing them as a single unified goal. The first framework mentioned is WASH, water, sanitation, and hygiene. It is a global initiative led by the WHO and UNICEF. The core philosophy here is that clean water is the non negotiable foundation of health. In public health practice, it is recognized that providing high quality food is useless if a person is drinking contaminated water. This framework ensures that safe drinking water, proper sewage disposal, and hand washing facilities are established as the primary requirements before any other medical or nutritional help is provided. Next is the Sun movement, scaling up nutrition movement. This framework introduces the concept of nutrition sensitive interventions. Instead of just focusing on calories, Sun ensures that hygiene is woven into the fabric of food aid. For example, when providing nutritional support to a community, they also include deworming treatments and hand washing. Education, the goal is to ensure that the body is healthy enough to actually absorb the nutrients it is being given. Next is POSHAN Abhiyaan, which is India's flagship program for holistic nourishment. The genius of this policy is its focus on behavior change at the grassroots level. It empowers community health workers to teach families that nutrition isn't just about what is on the plate, but how that food is handled. Their primary message, clean hands, safe food, emphasizes that hand hygiene is a direct ingredient in the success of a child's nutritional growth. Next is midday meal scheme, which is a school based intervention. While its most obvious goal is to provide a free, nutritious lunch to millions of students, its public health impact comes from its strict protocols. The policy mandates that school must have functional hand washing stations and that children must wash their hands in groups before eating. It also sets high standards for kitchen cleanliness. By doing this, the school environment becomes a living classroom where children learn that hygiene and nutrition are inseparable. Ultimately, public health is about prevention, dignity, and opportunity. To wrap up, I want us to look past the biological charts and see the human impact. A healthy community begins with the strength of its nourishment and the dignity of its cleanliness. By prioritizing these two things, we do more than just fighting germs. We unlock human potential and build a future where every individual has the vitality to thrive. Thank you so much for listening. Have a good day.